Well, for more on the latest on the COVID-19 pandemic and the long-term impacts of infections, let's bring in Gavin Macgregor-Skinner. Gavin is the director of the Global Biorisk Advisory Council and an infectious diseases expert. Welcome back to the show.
Good evening.
So as we saw, after that post-Christmas spike in cases to kick off the year, where do things now stand in the fight against COVID in some of these high-risk countries?
It's really interesting that we're seeing high vaccination rates here within the US, the UK, and many other countries keep a lot of the patients out of hospitals. But we also know from data from the World Health Organization and the countries themselves, there's still a lot of people within so many countries that haven't had access to the vaccines yet. And they're still they're unvaccinated. So they're very highly vulnerable to the strains of SARS-CoV-2 virus, the virus that causes COVID-19. Anywhere in the world right now. So we're seeing a shift in the pandemic here in the US, moving away from the emphasis on hospitalizations, more onto the emphasis of absenteeism from work.
And certainly something that we continue to see as people sort of keep catching like a second wave of the virus. Now, we do know that millions of people around the world have thankfully recovered from COVID at some point over the last 2 years, but people are still living with a lot of these residual health issues. Talk about some of the most common health issues in the short to longer term.
Well, over the 2-year period that we've been dealing with COVID-19, we've used this term called long COVID. And this is a wide range of symptoms that people experience many weeks, even months after being negative by testing. And so they've actually, they think they've recovered, but there's still, one of the really big symptoms that I see in so many patients is a crushing fatigue, where people just can't do things. They can't go upstairs. They're short out of breath. They have difficulty with memory, attention, anxiety. We call that the brain fog. But more importantly, we also are seeing some problems with kidneys, as well as irregular heart rhythms or elevated heart rate. And we're really seeing that there's so many people right now that are saying, look, I just don't feel 100%. I haven't fully recovered. Right. I want to go back to work, but I can't put in a full 8-hour day. I might be able to work 4 hours or 6 hours. So it's been really challenging for so many employers and companies on how to manage people that might have long COVID over a series of weeks or months.
And do we know, will Omicron patients experience the same or different issues compared to some of these other variants, especially given how the variants attack the body differently?
Well, that's a great question because we don't know what the cause of long COVID is. It's still very unclear. Now, if you'd asked me this probably 4 or 5 weeks ago about Omicron, no, we hadn't seen Omicron circulate for long enough. So again, remember, Omicron was really only identified back in November, and then it quickly moved around the world. But we are seeing it today, and we're seeing where people have maybe been infected with Omicron back in December, and then gone through a number of weeks, 3 to 4 weeks, 5 weeks, and saying, hang on, I'm not 100%. I've still got fatigue, brain fog. And so one of the theories we have right now is that there must be persistent viral material in your body. It's still causing long-term inflammation. We're not really sure why, but we are seeing these chronic issues extend for quite a number of weeks to months in people right now. So if you ask me that, just a few weeks ago, I'd say, no, I didn't have enough information. I'm seeing enough evidence from patients now that there is Omicron-related long COVID symptoms.
And obviously, this must be incredibly difficult trying to sort of get back to life as usual when you have these persistent issues. So then what kind of resources are companies or countries really providing to help deal with the physical aftermath of all this?
This is a really important question because, as you know, here working in the US, we only get a certain number of sick days. Some people don't get sick days at all. So if you have got the initial infection, and again, Omicron, we're seeing lots of night sweats, body aches, coughs, shortness of breath, really bad headaches, and then you recover and you've taken all your sick days, and then a few weeks later, you've still got symptoms where you're not 100%. How does then the employer then say, well, how much time do I give you off? So what we're seeing right now, the Federal Healthcare Agency, known as the Centers for Medicare and Medicaid Services, or CMS, is actually sponsoring and starting up programs. We're seeing a lot of post-COVID rehabilitation programs. We're seeing long COVID recovery programs. Within companies, I'm seeing wellness programs in private companies. So again, people are recognizing that long COVID is real And there are so many people within the workforce now that need special attention, they need care, they need assistance and help to manage the anxiety, the depression, but also these common complaints of chronic fatigue, brain fog, and just being out of breath or having muscle aches.
And just very quickly, you mentioned things like brain fog. We talked about the physical. What about mental health? What sort of options are there, and what sort of strategies would perhaps work the best for this situation?
Again, a lot of wellness programs that I've seen that have been created both within the public healthcare system, within hospitals, private hospitals, but also within companies. And again, one thing that I'm seeing a common theme across so many companies now is creating buddy systems. Again, meditation, again, support. So in a lot of the big companies that I help right now manage COVID-19 within their workforce, they've formed a buddy system where you actually have someone to talk to about non-work related issues. You can actually express how you're feeling today, or they may even check in on it. They may send you a text message or a phone call in the morning saying, how are you feeling? Can you come to work today? Can you work the full 8 hours? And so we're really, as a manager, as a supervisor, that's proving some challenges, but we have to make this workforce be productive, and we have to come up with these novel solutions to ensure that we are productive and we keep the economy going.
Lots of great tips there. Thank you so much for joining me today. Gavin Macgregor-Skinner, Director of the Global Biorisk Advisory Council and an expert on infectious diseases.